First, we're going to start with our preliminary assessment. At this time, we don't have anything else on our desk or on our cart. We really just have the patient's MAR, highlighter, pen, scrap piece of paper, and our drug book if we need to refer to it. So first we have Olivia Bennett, our patient in 512C. Her date of birth is May 22nd, 1950, so that tells us that she's an older adult. She was admitted on October 16, so 2 days ago, 2020, and we have the correct MAR. It is for today's date, October 18, 2020. We can see that she doesn't have any drug or food allergies, and her admitting diagnosis is type 2 diabetes and gastroesophageal reflux disease. And we can see that her doctor is Dr. Chan. I already can tell that she has 2 scheduled medications, which I will check shortly after this check. I can see that the MAR continues on the next page, and we are on the page 1 of this MAR. Moving on to page 2, we still have the same MAR for Olivia Bennett. We can see that she has 1 PRN medication. We can see that this is the final page of the MAR, and the MAR has been checked by the night nurse, whose name is Jay Slotsky, and this is page 2 of the MAR. So going back to the first page, we want to make sure that we are very aware of all the meds that she's on. So we actually complete most of our checks at this point. We can see that, again, we have Olivia Bennett as the right patient. We're checking to see if she has the right medication for the right reason. So we know that Pantoprazole is a proton pump inhibitor, and it says that it comes in 20 milligram tabs. However, the doctor's order is 200 milligrams. So I'm going to go ahead and check and see if that makes any sense. But I do know that Pantoprazole is used for GERD. I can go ahead and perform my formula. Remember that I'm writing down the dosage ordered divided by the dosage on hand multiplied by the amount. So in this case, my dosage ordered is 200 milligrams divided by the dosage that I have on hand, which is 20 milligrams times 1 tab, which that doesn't make sense. So I'm going to go ahead and check Pantoprazole. So this is when I would consult my drug book, and then I can see on my drug book that yes, it is Pantoprazole, that it can be used for GERD, but it says that the adult oral dosage is 40 milligrams per day for 8 weeks and can be repeated. So 200 milligrams is for sure not the right amount. So I'm going to go ahead and check the doctor's order to see how much the doctor actually wanted. And if the doctor's order states 20 milligrams, then I know that there's an error in transcription. If the doctor's order states 200 milligrams, then I would have to call the doctor, which is Dr. Chan, to just double check and clarify how much he actually wants us to administer for today. So I should be aware of any vital signs, any lab values, any assessments that I need to perform prior to, given that Pantoprazole is to be administered today at 8 o'clock. I also need to be aware of any adverse effects. So I would be doing that for each and every single one of the medications that we have to make sure that we're prepared prior to. Okay, and then we also want to check that we have the right route, which is PO, and the right time. It says BID. We checked against the drug book, and it does say that we can give 40 milligrams in 1 day, and we can see that it's to be given twice a day for 20 milligrams. So that all makes sense. And then for any PRN medications, we just need to know what the last dose that was administered and when it was last administered, and then correct anything else that needs to be corrected. So now that we have found all the errors and we've discontinued the medications accordingly and we've retranscribed them, then now we can start our 3 checks. So let's start with Pantoprazole. Start with our first check. Olivia Bennett, Pantoprazole 20 milligram tabs, example Pantoloc, 20 milligrams PO BID at 8 o'clock. And check the time, it's at 8 o'clock. Pantoprazole 20 milligram tabs, example Pantoloc. We'll go ahead and make sure that what we have is right. Pantoprazole 20 milligram tab, expire date is 2022. Second check. Olivia Bennett. This is for Olivia Bennett. Pantoprazole 20 milligram tab, example Pantoloc. I'm giving 20 milligrams PO BID at 8 o'clock. Pantoprazole 20 milligram tabs, Pantoloc. Pantoprazole 20 milligram tabs, expire date is 2022. So that's the second check. Because it's in a little unit dose, we can pour it aside. We can go ahead and circle that we have poured it, and we can perform the third check. Olivia Bennett, Pantoprazole 20 milligram tabs, example Pantoloc. Pantoprazole 20 milligram tabs, example Pantoloc. I'm giving 20 milligrams PO BID at 8 o'clock, and I should have 1. Just want to double check what we have here. Pantoprazole 20 milligram tabs, expiry date 2022, and we have 1. So now that can be put aside. Go ahead and select metformin. Okay, we have Olivia Bennett, metformin 500 milligram tabs, example glucophage, extended release. I'm giving 500 milligrams extended release PO BID at 8 o'clock, and we checked her blood glucose and it's fine. So metformin, extended release, 500 milligram tabs, example glucophage XR. See, we have metformin, 500 milligrams, expiry date December 25th, 2022. Second check. Olivia Bennett, metformin, 500 milligram tabs, glucophage, extended release. I'm administering 500 milligrams extended release PO BID at 8 o'clock. It's 8 o'clock. And I should only be giving 1 medication. So we have metformin, extended release, 500 milligram tab, glucophage XR, metformin, 500 milligrams, expiry date December 25th, 2022. And we just need 1 tablet. So you can 1 tablet, put that on there. And we can circle. We poured it. And then once again, we have Olivia Bennett, metformin, 500 milligram tabs, example glucophage, extended release. We're administering 500 milligrams extended release PO BID at 8 o'clock. Metformin, extended release, 500 milligram tabs, glucophage XR. Metformin, 500 milligrams, expiry date December 25th, 2022, and I should only have 1 tab, and I double check, and I only have 1 tablet. So that goes back. And then we have our last medication for 8 o'clock. that the patient needs. So once again, we have Olivia Bennett, Lactulose 10 grams per 15 mL oral solution, example annulose. We're administering 15 to 30 mL PO BID as needed at 8 o'clock. We checked the last MAR and it said that they were administering 30 mL, so we can go ahead and administer 30 mL. So lactulose oral solution 10 grams per 15 mL. And you can see lactulose solution concentration is 10 grams per 15 mL, and expiry date is September 2022. Okay. Second check, Olivia Bennett, lactulose 10 grams per 15 mL oral solution, example annulose. We're administering 15 to 30 mL PO BID PRN at 8 o'clock, and we're going to give 30 mL. Once again, lactulose oral solution 10 grams per 15 ml, lactulose solution 10 grams per 15 ml, expiry date September 2022. So we can go ahead and pour the solution. So we're giving 30 mL, and we'll pour 30 mL. I'm going to squat. So we've poured it. And third check, we now have poured our medication, Olivia Bennett, lactulose 10 grams per 15 mL oral solution, example annulose. We're giving 15 to 30 mL PO BID PRN at 8 o'clock, and we should have poured 30 mL. It's again Olivia Bennett, lactulose oral solution 10 grams per 15 mL, lactulose solution 10 grams per 15 mL, expiry date 2022. We should have 30 mL, and we're looking at our meds, and we have 30 mL. So we can put that back to the bag. Okay, now that we have all our medications with us, we have our water, spoon if we do need it, we have our lactulose and our 2 tablets. We can put this away. That goes back into our drawer. And we take the MAR and everything with us. So now the patient has taken the Pantoprazole. We can go ahead and initial RT. SCSPN. She's taken the metformin, SCSPN, and the lactulose, RT, SCSPN.